Hello, my name's Sophie Hasty and I'm the Parent Education Midwife at Warwick Hospital, also known as Swift. Welcome to the Path to Parenthood preparation for twins. In this video I'm going to talk a little bit about what it's like having twins and how we care for you during your pregnancy and your birth. It's worth also watching Preparation for Labour and Birth and Preparation for Parenthood, which talk more generally about labour, birth and the early days with your baby. Congratulations on being pregnant with twins. This is a very exciting time, but many twin parents feel shocked and anxious when they are told they are having 2 or more babies than when they were only expecting 1. It is normal to go through a wide range of emotions and for these emotions to fluctuate from one day to the next. You may be feeling excited, or you might be feeling a bit anxious or frightened, or a mixture of all of these feelings. The maternity staff here at Swift are here to help and support you as much as we can. You will be allocated a named midwife and a named consultant obstetrician. If you have any concerns or worries, speak to either of them and they will discuss your concerns with you. And if you need any extra support, they can arrange this for you too. Your care will always be led by a doctor who is a specialist in pregnancy care. This sort of doctor is called an obstetrician. You will have a consultation with your obstetrician at around 16 weeks to agree a plan of care for your pregnancy. This may be done by phone rather than face-to-face. Towards the end of your pregnancy, you will have some extra scans. These are usually every 2 to 3 weeks. And these are to check that both babies are growing well and at the same rate. You may well be invited to the hospital, maybe twice a week towards the last few weeks of your pregnancy, to have some monitoring of your baby's heartbeats. This is on a CTG machine, there's one in the picture here. And to use this we put some straps around your tummy and strap some paddles onto your tummy, and these give us a paper printout of your baby's heartbeats in relationship with any contractions that you might be having. Twins often arrive early, and if it seems like your babies are going to be born early, you may be offered steroid injections to help their lungs mature. This is quite routine. Towards the end of your pregnancy, you will have a discussion with your obstetrician to agree a plan for the birth of your babies. Twins are often born early, so this discussion will probably happen between 32 and 36 weeks of your pregnancy, although it may be earlier if it is thought likely that your babies may be premature. Your doctor's recommendations will be based on what is safest for you and your babies, but it is very important that you understand the reasoning behind your plan so that you can make a decision based on knowledge. Ultimately, how you are cared for is your decision, and nothing can be done to you that you do not agree to. This is called informed consent. There are loads of potential variables with any pregnancy and birth, and doubly so with twins. So I may not cover your particular situation, but I will go through some of the commoner recommendations. Your plan and care will be tailored to you, your babies, and your pregnancy. The labour ward is recommended as the safest place for your twin babies to be born because there is help available quickly if your labour becomes complicated. The position that your babies are in has a big impact on how easy it is to birth them vaginally. The best position for your babies to be in prior to labour is both of them be head down and lying along the length of your body, just like in this picture. If your babies are in this position and everything else is okay, your doctor will probably encourage you to aim for a normal vaginal birth, but other circumstances may change this advice. If the baby that is coming first is not head down, they may recommend a caesarean. Even when everything looks good for a vaginal birth, there is still around a 30 to 40% chance of a caesarean being needed for both babies, and up to a 15% chance of it being needed for the second twin after the first twin is born vaginally. This would happen if the second baby's head did not come into the birth canal in a good position, or if the baby became distressed. It is normal for there to be up to an hour between the birth of the two babies, but please be reassured that the well-being of you and your second twin will be closely monitored during this time. It can be difficult to tell the heartbeats of twins apart using a handheld Doppler machine and listening in intermittently. The obstetrician may suggest that it is safer to use a machine that allows staff to monitor both heartbeats continuously throughout your labour, so that we can make sure they are coping with the contractions okay. All pain relief options will be discussed, and in some circumstances an epidural may be recommended, so that if the birth becomes complicated or if you need a caesarean, you will already have effective pain relief in place, and this makes it quicker to birth your babies safely. There will be a few members of staff present for your birth. For a vaginal birth, these would be 2 midwives, an obstetrician, and 2 paediatricians who are baby doctors. Other members of the team will be available in the department in case they are needed. If you have a caesarean, a full anaesthetic and theatre team will also be present. Your placenta or afterbirth will be bigger than if you were having one baby, and this can lead to an increased chance of you having heavier bleeding after the birth. To stop this, it will be suggested that you have an injection after your second baby is born to help your placenta come out and reduce the bleeding. It may be also recommended that you have a drip with a drug to stop the bleeding as well. As long as your first baby is well and there are no complications for either you or your baby, then your baby can be skin to skin with you and even breastfeed while waiting for twin 2 to be born. If this isn't possible, but your baby is fine, then they can have skin to skin with your birthing partner. When your baby's cords are clamped and cut, the midwife or doctor will put 1 clamp on your first baby's cord and 2 on your second baby's cord, so that we can tell them apart. Your babies will have name tags on their ankles, and it is very important that they wear these all the time that you are in hospital. You may find that it's difficult to tell your babies apart yourself, so when you go home, you may want to put different clothes on them so you can continue to tell them apart. Skin-to-skin contact with your babies makes them feel safe and settled. It helps to regulate their heart and breathing rates and gives them a big rush of the love hormone oxytocin, which helps their brains to develop. Many babies will find their way to the breast during skin-to-skin contact shortly after birth, and this gets feeding off to a flying start. Feeding twins can present new parents with some logistical challenges, so ask for help from the midwives while you are in hospital. To begin with, you will probably find it easier to feed your babies one at a time, but as you all get more practiced at feeding, you may prefer to feed your babies at the same time, as this will reduce the amount of time that feeding takes. This does take practice and can be tricky to start with, so having people around to help is invaluable. It may be helpful to spend a couple of days in hospital to make sure that you are confident with feeding your babies and you and they have got the hang of it. If there are any concerns about either of your babies, they may have some extra checks, such as having their blood sugar tested every few hours. The paediatricians and the midwives would explain this to you. Because twins are more often small or premature, they sometimes find it difficult to attach to the breast or need some extra milk after a feed. From 36 weeks of your pregnancy, you can begin hand-expressing colostrum so that you have a supply ready for your babies. You can collect the colostrum in small syringes, which you would then freeze and bring into the hospital with you. Ask for some syringes at a clinic appointment. Once your babies have arrived, you can boost your milk supply by continuing to express. In the first few days, hand expressing may be the most effective, but you may find using a pump is easier, and that's fine. For more information about caring for your babies, feeding and expressing, have a look at the Path to Parenthood, Preparation for Parenthood. Twin babies are more likely to need some extra support in the Special Care Baby Unit or Neonatal Intensive Care Unit after they are born. This may be for just a few hours or several weeks, depending on their circumstances. Most commonly, this is because they are born early or are small for their stage of pregnancy. If this is needed for one or both of your babies, the reasons will be fully explained to you, and you will be encouraged to be as involved as possible in their care. Breast milk and colostrum is vital for premature or unwell babies, as it has powerful healing and protective factors that prevent some of the complications of prematurity. So however you choose to feed your babies in the long term, you will be encouraged to express in the early days, as giving your babies this early milk is like giving your baby medicine. There are lots of videos and websites around breastfeeding on the internet. There's an excellent series of videos by Global Health Media about breastfeeding. They don't have one specifically about twins, but their video attaching your baby at the breast explains the principles of good attachment and positioning very well, and these principles are the same whether or not you're breastfeeding one or two babies. There's another video by Best Beginnings called Breastfeeding Twins or More. This is specifically about breastfeeding twins, and it talks about the specific issues around breastfeeding twins and positioning them. Lots of people like to meet other people who have already had twins or who are also expecting twins. There are a couple of national twin organisations which can help you do that, and their websites are full of useful information on twin pregnancy and birth and preparing to live with twins. They are called the Twins Trust, which has a branch in Evesham, and the Twins Club, which has a branch in Leek Wootton, just outside Warwick. I hope you have found this helpful. If you have any questions, please speak to one of the midwives or your named obstetrician. It is also worth watching the Path to Parenthood videos of preparation for labour and birth and preparation for parenthood. There is much more information in both of those. Good luck. I hope your births go really well, and thank you for watching.